Hello, I'm Dr. Pradeep, and today we're going to have a quick talk with Dr. Romel, HPB and liver transplant surgeon, and Dr. Naveen Ganjo, a hepatologist. So we're going to address about questions regarding general liver health, and we have a list of questions that the doctors are going to address for us today. So the first question being, so what does the liver do for us?
So liver is a very important organ for us. It does many functions, and namely most important are detoxification of drugs and alcohol, absorption means digestion, what we digest, what the food we eat, and of course it manufactures the immunity for our body, and also it helps in preventing infections, which is very important. So these are the basic things that we talk about liver, but there are many more. So liver problems are very common these days. Very important is lifestyle related, because our lifestyle has become such that we do not burn what we eat, and unfortunately what we eat is not right. So lifestyle has become bad, and it's the most important thing, and we have lot of indiscriminate use of medications, lot of alcohol, and these fatty liver together has made it difficult for us, and the liver suffers because of all these things. So fatty liver is when fat sits inside the liver. This fat can start damaging the liver further on, which can cause lot of things like inflammation and damage to the liver, leading to cirrhosis, which is the final stage. So when fat is there, it causes mainly some fatigue and all that, but when it starts damaging, the liver starts misfunctioning, and that is when it starts becoming dangerous, and it needs to be prevented. By prevention, we do the checks and find out what is wrong with the liver, but mainly fatty liver, if it progresses, very dangerous. It has to be caught early on.
Dr. Romel, can you tell us, is liver cancer lethal? Is there any treatment modalities that we offer?
Our perspective to liver cancer has changed over the years. This is a lot got to do with evolution in our treatment protocols, our surgical protocols. So it is not a lethal condition, or it's not a taboo as it used to be. We are much ahead than what we were about 20-30 years ago, and liver cancer for now can be cured 100%. We have various treatment options, from non-invasive to invasive to transplant as the final option. So liver cancer definitely is not a lethal condition, and it can be cured completely.
So in this, if I would like to add, most importantly, it is earlier you see the prevention. Earlier you see, earlier you treat. Late, it becomes always difficult for any disease as such, and so the same in liver cancer. So early referral and early treatment is 100% cure, as Dr. Romel just mentioned.
So who needs a liver transplant, and where do we get this liver from?
So like we know, liver transplant now is an established modality for any sort of liver failure. When we say liver failure, it could be a broad entity where there's something called as an acute liver failure, or there's a chronic liver failure. So when we call a chronic liver failure, is a liver is failing and it is showing increasing signs of failure, like it could be a jaundice, or it could be an altered encephalopathy, bleeding, various other signs are there. So these are the patients who qualify for a liver transplant, which means to say that the liver is completely failed, is not functioning further, and this organ needs to be changed, and they have to undergo a liver transplant. Coming to the question of where it is done, liver transplant has to be done in a center which is dealing commonly with liver conditions and performing transplants regularly, as in Aster. The most important thing is, one, a patient needs a transplant. Second, are they fit enough to undergo a transplant? So this has to be done under the setting of a liver transplant team, a team which includes a variety of people, right from hepatologists to surgeons to so many other people. There, patients are evaluated, and then they are listed for transplants. Transplants can then be of two types, which is a live donor liver transplant and a diseased donor liver transplant. Obviously, more information regarding that they can get it once they come to the liver transplant centers.
So the liver transplant you mentioned about, can you tell us the success rate of this procedure, sir?
Yes, that's a very nice question. If you look at the history of liver transplant, it started somewhere, in the late 60s and 70s, where it used to be a dreadful operation. But now we have evolved so much, and mainly got to do with improved immunosuppressive practices, surgical practices, intensive treatment. Now we are looking at success rates of in excess of 95%. I mean, it's difficult to believe, but yeah, in excess of 95%, there can be success rate which can be achieved for a liver transplant procedure. It varies depend upon the condition of the patient, how fit they are before surgery. That also plays a big role in the outcomes of post-transplant. But like I said, we're looking at 1 year survival rates of about almost 95% now.
So a general question that the common people have, what should we do to keep a liver healthy, sir?
The few simple things: have a healthy lifestyle, balanced diet, and most importantly, physical activity. So if you keep all these things together, liver will stay healthy. But having said that, how to do it in our lifestyle today is most importantly, keep a healthy lifestyle, keep physical activity where you sweat, eat what your body can digest, and most importantly, find out what is damaging your body or causing fatty liver. The diets that we have, there are a lot of myths and wrong misconceptions regarding diet. So all these things need to be thought about, because diet is never a prescription. It has to come as a way of life. Once that happens, it never causes the damage to an extent when there is no point of return. So most importantly, these are multimodality treatments and discussions. When somebody talks about a healthy liver and healthy life, we at Aster here have a complete team, from nutritionists to hepatologists to liver specialists to everybody else, so that we give complete care for our patients regarding healthy liver or healthy you in general.
So like you have a heart fitness, very important to know have to something has a liver fitness, if your liver fit or no. Like Dr. Naveen was saying, fatty liver needs to be nipped in the bud. So make sure that you get your checkups regularly, especially concentrating on your liver, so that if there's any condition, if there's any modifiable conditions, they can be picked up early and managed accordingly.
As we know, healthy liver is healthy you. It is a responsibility of each one of us to come together to prevent liver disease. The burden of disease, this disease has become massive, so that we can have this prevention which we are talking about today, and we see less and less progressed liver disease and liver cancers. So we need to come together for a better future.